Hey everyone, welcome back to my channel. Doing a quick little medical update. Sorry I haven't done one of these in a while, but been a little busy, and I also wanted to get a little bit more information just so I could have it all ready to go for you guys when I did it. By the way, loving this new angle we're at right now. A lot clearer, a lot more level. So the big issue right now is that my pigment and my catheter aren't giving proper blood draw. Sorry about that. So there's talk about using another device to replace my catheter, because since it's not giving proper blood draw, that means when they hook me up to dialysis, it's also not running the blood properly. It's not going through the device right. So, and the issue is they can't keep replacing it in the same area because over time the vein just kind of gets tired, and they can't keep replacing it in my chest because on both sides I have too much scarring due to old ports I've had, old Hickmans I've had, other catheters I've had. It's just starting to be an issue. So we're having an issue with finding a new one to place or a new device to place because they're talking about doing a fistula, because other catheters would usually go in the leg, and we can't do my legs because I have too many wounds and they're too swollen to support it. And we can't do my groin area because it would just be dangerous and possible for infection. So they're talking about doing a device called a fistula. So, but the problem is that would go in my arm, but my veins, because of over time so many different devices and IVs and issues, my veins are so weak that like even just to get a regular IV, it takes 2 or 3 pokes, and even then I have to be like really careful. I can't move or anything because the vein would likely pop. Sorry about if there's noise in the background, by the way. So I have to see different doctors to see if my veins would even be strong enough to support the fistula. And also, getting a fistula would kind of be an issue for me because it is a device in your arm, but it requires getting poked every time. And I don't do very well with pokes. It's like a PTSD thing. By the way, if you see me looking down or looking around, it's because I'm looking at the information on my phone just to make sure I'm giving you guys everything. So, aside from that, the issues that I have from my doctor, I have acute arthritis in both shoulders. So, movement is really hard. And I would show you my left arm, but it's so heavy with the lymphedema that I have, that I can't really lift it to show it to the camera, especially with where the camera is sitting. Maybe I could add a picture or something, but otherwise you could kind of look up what a lymphedema is. It just means that there's a lot of swelling in the area, a lot of fluid buildup, and it makes it really heavy. Like I need my mom to help me lift it and stuff even when I get dressed. So it's already hard to lift that arm, and then the other shoulder has acute arthritis as well now, and it's been harder to move that arm, the right shoulder, because it started as a torn rotator cuff, and so I had issues as it was. But my DO, doctor of obstetrician, I think that's what it stands for, but I'm not sure, so don't hold me to that. But he does kind of like muscle manipulations, and so he was helping me to move it, and I was doing work with it in the hospital. But since I've been out of the hospital, I don't have anybody to work with me on that, because I get physical therapy, but I guess I don't qualify for the doctor I need that does like my arms and stuff. But back to the point, it started as a torn rotator cuff, but because of the steroids I had to take in order to manage my cancer and then manage my what's it called, my weakened immune system. uh the bones literally started to separate. So now through an x-ray, to the naked eye, it looks like the bone is broken. It's not, obviously, because I'd be in much more pain, I imagine. um but like the bones are actually separated to the point where it looks broken. And right now, my doctor is, my ortho doctor is supporting that I do physical therapy to keep it from worsening and to keep it so where I can do some movement. And my other doctor, the one that I told you does the muscle manipulations, has asked me to do deliberate movements. So instead of just reaching my arm out, I have to reach my arm forward and then reach my arm out, which can be difficult because it's not something you're used to. You're used to just like grabbing things and stuff like that. So, like, when I go to reach the cups on my side table here, sometimes I'll just reach out to grab it, and that can be very painful because either my shoulder will crack, like actually crack, sometimes you can hear it, or I get really bad pains in my bicep, really sharp, like jabbing pains, and it's really, really painful. Like, I feel bad for my sister because her room is right across from mine, and anytime I have a pain, ow, ooh, and I feel like she hears me all the time, and I don't want to be interrupting her or agitating her or anything. But that happens a lot because I'm still not used to the deliberate movements yet. So I'm hoping that my physical therapist will help me with that. And I even got a note from that doctor because last time I saw my physical therapist, they said they were nervous to move the shoulder because of what I had told them, that it looks broken through x-ray. Um, so they wanted me to see the ortho doctor first, which is another reason why I waited to make this video. But on to the next point. Because of what it looks like, the only like real solution right now would be to put a metal joint in, almost like when you get a hip or knee replaced, which would help the situation, except for the fact that because of my age, I would have to get it replaced a lot. Because if you think about it, like, older people, you're not developing anymore. You're pretty much set where you are. And because I'm only 25, about to turn 26, my body's still going to go through a lot of changes, a lot of growth. And so the metal joint would be a lot. And I can't do surgery right now anyways because oh, sorry, my mom came in. That's fine. I can't do surgery right now anyways because my keratin is too high. So that means like I need more dialysis, and I would literally bleed out on the table if I did surgery right now. So that would be very dangerous. Plus, I'm anemic, so that means that my blood is thinner. So I bleed more than most people. So, like, if I get a little cut, most people would just be like, oh, just put a band-aid on it. I would probably bleed through the band-aid. So there's like a lot going on with my health right now. Please pray for me because it is very painful, like, to move both arms, to, and it's very limiting. I can only move this arm to here. This is the left one with the lymphedema, and this is the one that needs the joint, and I can only move them to here. So it's difficult because, like, I can't wash or brush my own hair. I can't, like, I did my own nails, but doing them was really hard because the whole time my hand was like this. I can't do my own bathing. I can't reach for stuff a lot on my own, and if I do, I have to like lean over to do it, and it's it's very trying on my patience sometimes because it's very frustrating already since I can't walk and I can't get up to get stuff. So now, like, I can't even really reach for stuff. I have my bedside table, and that helps because I can set like stuff that I need immediately right here. And I have room on the sides of my bed. So sometimes, like, if I'm planning on doing activities during the day or things like that, I can do it. But I'm finding certain things harder on my body to do. Like, was it yesterday or the day before? What's today? Tuesday. Sunday, I was trying to work on a Lego because I enjoy doing Legos, and I was kind of hunched over like this, and I noticed that I can't be in that position very long. It's really hard on my shoulders, and it's really hard on my back, and it's kind of frustrating that I can't do something I enjoy, and that makes it harder for me to like paint or color and things like that as well, because I usually kind of lean over when I do those things. So for a lot of the time, I have to be sitting straight up like this to support my back and my shoulders. And I also have to ask my family to pull me up in bed a lot because of that. And I hate doing that because I already feel like a bother as it is to my family. So, and I know I shouldn't. I know that I can't help it and things like that. And I'm already worried about my medical stuff, and I shouldn't be worried about that too. But I can't help it, okay? I can't help it. It's who I am. So, anyways, that's my medical update right now. I have an appointment for my catheter in about 2 weeks, and it'll be 2 months before I actually see the ortho doctor again. But I should be seeing other doctors about my veins and stuff soon. And right now, I'm trying to make an appointment for my glasses because I can see you guys on the camera, but any farther than that, um, it's really blurry. I can't see anything. I haven't gotten my glasses done in like 5 years. So I'll try to get you guys another medical update soon, and I'll be working on some other videos soon as well. But that'll be all for this video, and I will see you guys in the next one. Bye.